Hello and welcome to this edition of Central Connecticut Now, the program that brings you closer to the newsmakers in our communities and the people that cover them for us. I'm Mike Schroeder, publisher of the New Britain Herald and Bristol Press, and I'm happy to introduce Kurt Barwis, President and CEO of Bristol Health, what most people know as Bristol Hospital. Kurt, welcome to the show.
Mike, thanks for having me. I really, truly appreciate it.
Kurt, you know, you've had a great year so far.
We have had a great year.
You know, we see it every day. It's literally across the street from our building.
It's our new medical center. We opened that just a couple months ago, and it's been extremely well received from the community. You know what I say, and I mean this sincerely, is you can build a building, you know, and you can hire somebody to build a building, and that's great and all, and you hope people come and patronize it, or you can partner with your community. And together you build something that's really unique and special, and I think that's the way I would characterize what we did.
It was a really beautiful building to be in, to see.
Yeah, it is.
You know, and it's a great thing to be able to be in a place that was planned.
Yep.
That not just added on, and like most hospitals that are, you know, you start with a building.
Correct,
this one went out this way. This one went out this way, and
true.
But it's just the smell of fresh.
It is the smell of fresh, and the artwork is really interesting as well. It's all local artists, so we really went through. I was really shocked when we opened it up to local artists to see the diversity and the kind of artwork that was there, the different medium, and it's just beautiful, as you said, really. And the physicians and the patients love it in there.
Now, how many people are in that building now?
So I would say probably all total between physicians and staff, we probably have 100 people in there.
Wow.
I think, you know. It depends on the day, obviously, and what we're doing. But if you add everybody up, I think you're pretty close to that number.
And maybe you can give us just kind of an overview of what is in that building, what services are provided, when you could expect to go into that building.
Sure. So it's a specialty building. So we put a lot of specialty practices in there. So all of our orthopedics practices are in there, neurology, endocrinology, rheumatology, cardiology, all the ologies are in there, so to speak. And we do have expansion space on the first level. We're hoping to recruit ENT into that area. And then we also have all of our lab draw stations in there. That's, I think, you know, people are just now getting used to it. They can go in and get a cup of coffee and drop down in the elevator and get their lab test done in the morning. Or actually,
you have a nice little cafe in there.
Isn't that great? Isn't that
That's
great?
right.
It could be in reverse. Obviously, if you're fasting, you want to go get your tests. You can get your PT, and then you go upstairs, get a sandwich, a breakfast sandwich, or a lunch sandwich, and so it's really. And I don't think I missed anybody in that. Our diabetic center is in there. So it's really a lot of specialists, and the idea is that they all kind of work together as a team. And I know this because I just took my dad through the whole program.
Oh, goodness.
He's just about 90, so I took him through a whole series of different tests and things to get his balance in a better place.
Oh, wow.
And believe it or not, it's actually worked. It's amazing. So, but yeah, it's all the specialists, and then there is room for expansion. So if you're on the Riverside Avenue street and you're looking at the building, out to the left, we could go another 36,000 square feet there.
Oh, goodness. New building space.
New building, yeah.
Wow.
Attached to it, you know, right next to it.
Oh, that's pretty incredible.
Parking is going to be is obviously
going to be
something that's
interesting.
a challenge. We can actually we can put a one-level deck on top of that parking lot that's there, which I thought was expansive until I was driving by there the other night and I noticed how many cars were there. So it depends on what the city does. If the city then builds some more, you know, parking garage, then obviously we wouldn't deck it. But you know, I think you'll see us start to. We're in the throes of a strategic planning process. When we finish that, I think that'll kind of inform what we do with that space. But I kind of like the idea of putting an ambulatory surgery center there, so an outpatient surgery center there, which really makes it very convenient. So the surgeons can just go right across into that building, and folks don't have to navigate any complicated environments, park, go in, have your surgery, come out.
It's certainly a landmark in downtown now. I mean, it finally jump-started the redevelopment of the city center.
You know, and that's again, that goes back to this whole notion of, you know, you can build a building or you can work with a whole community and do something very special. And I think that's really what we set out to do, and I think that's what it ultimately came out to be. For me, I mean, it's an incredible sense of pride. I drive past that building every morning on the way to work. I drive, you know, as it was being built, and you know, you see it on paper and it's one thing, but then when you actually see it coming out of the ground, I'm like, wow, was it really supposed to be that big?
And this is from somebody who's added a lot of services and new space at the hospital campus itself.
Absolutely.
But it's all kind of hidden, and you fit it in where you could.
That's what hospitals do. That's right.
That's right. And this is the ground up.
Yep, this is the ground up, and it's we were thrilled to partner with the city on this. I mean, it really, the partnership, I think, really kind of defined a going forward relationship. And it really kind of gets into, other than here's this building, it's like, how do we address things like substance abuse, and how do we partner on other things, and that's a really exciting thing. You know, it's really evolved us in a really unique way. Working with the police department and others, it's just been a tremendous partnership.
And you've got you've already got a Main Street partner going in next door.
Oh yeah,
a new developer.
Absolutely.
And so that is already being built out.
And across the street, which I'm not sure if you're aware of this, so I'll tell you, we just vacated the Eagle and Funk buildings. Well, we're still in the Eagle building a little bit. We're trying to work through that with our Parent-Child Center and our WIC program. But
those are the buildings down, further down on Main Street,
right
correct?
On the other side of the railroad track.
Got it.
So within an eye shot of the new building are those two buildings, and so we signed a letter of intent with a developer. And we're working with the city and the developers working with the Veterans Administration. The plan is to take the Eagle building, or the Funk building, which is the largest of the two buildings. And I think the estimated investment is about $15 million in there. And the plan is to essentially have about between 50 and 60 veterans in there. And then they would basically get education across the street at the Eagle building, whatever the Veteran Administration says is the right thing to do, what kind of certification program or whatever under
so part of it would be residential,
and the other part, and it would just be episodic residential. Get your education, live in this space for a year, and then you evolve and hopefully go on. Unlike the other property that's over by the Boys and Girls Club, the one that you can live there forever. This would be, you know, you'd live there for 12 months, get a certification, education, and move on. Yeah, it's I'm very excited about.
Where did that idea come from?
So, boy, that's a long story. That would take this whole program to describe. But actually, there was an outreach to us. From some individuals in the community and some folks from New York City, from folks in Florida, and somebody had an idea. We really weren't sure initially whether this was real or not, and then as we kind of kicked the tires and got to know each other, it evolved into us understanding this is a real deal. I mean, that this developer really means it and cares a lot about the veterans, and actually we'd be part of kind of what is a syndicated kind of offering. They've bought hospitals that have been vacated. They've bought other buildings in other cities all around. I think one is in Pennsylvania. There's some in New England. And they are really focused on what they call veterans private partnerships. So they fund it, they create it, they get it running, they get it sustainable, and then I guess part of the exit would be eventually, potentially selling it back to the Veterans Administration. So, but who knows if that actually happens or not.
When do they expect this to be in play?
Well, our agreement is a 4-month, I think it's 4 or 6 months of investigatory work. So it's an iterative process where they're constantly going back to the VA and making sure that that this is really this is what's going to work and the kind of program they want. They're studying the buildings. Obviously, the Funk building is quite old, needs a new roof, needs the investment, and then the roof actually has to be raised in the back. It's a shed roof in the back, so they have to raise it to make it accessible for folks to live in it. So So we vacated it. We're in the carpenter space down on North Main Street. Well, it's actually not on North Main Street. It's right behind North Main Street. So we just consolidated all of our business office functions together. Home care, hospice are in that building, and then marketing. We took a floor that was, I guess, once occupied by Cigna.
Wow.
And they left, by the way, left all the cubicles. So it really made a lot of sense
How
for us. It was a
convenient
really reasonable
is
way to run
that?
it. And honestly, shout out to George Carpenter Jr. did a really good job with us and really delivered. So yeah.
That's exciting.
And so you see that building downtown here. We also have one. We have a project going on in Southington. And we're working hard. It was a Rite Aid. We're redeveloping the Rite Aid to be a medical office building.
Is that the Rite Aid that's right off the highway?
It's the Rite Aid that's right next to the Bradley campus. So if you go through the center
Oh, yeah,
of Southington,
yep.
and you go through the center of Southington, we're right in the center right now. You go out of town a little bit on the left-hand side, it's right there. And so we're doing really, really hard work to make sure that the outside of the building kind of looks like the building we just built. So
Wow. Oh, that's
so
terrific.
welcoming and,
Oh, my goodness.
yeah.
And when do you expect that to open?
So December.
Oh,
so
my
that's
goodness.
fast and furious, yeah. Yeah, it's like, it's very positive. I think we're seeing the receptivity to, basically our outreach, improvement in accessibility throughout the communities we serve. We're seeing all of that. And then on the inside, we have a whole bunch of new programs that we've really invested in. We created a center of excellence around EBIS and EUS. So it's a technology that our pulmonary critical care docs are using, used in the diagnosis and treatment of lung cancer. And then our gastroenterologists are doing EUS, and we just saw the addition of an amazing new physician, Dr. Liam Zacco, and he was a Yale medical student, went to Mayo, and then did a really extensive fellowship at Dartmouth Hitchcock.
Wow.
And probably one of the most advanced gastroenterologists in the States. So at least current training and stuff, and so he's doing specialized procedures at our facility. And
So we may talk a lot about facilities and buildings and that kind of thing, even technologies.
Yeah.
But we're talking about people too. We're
all
talking
about
about
people.
real
Yeah.
people that know what they're doing and how to bring it to a local community hospital.
Yeah, and we were talking earlier, and I say this, and I don't even hesitate to say this, is if you stick to what your community needs, what they truly need, and if you focus on those things, you basically do a couple things. One, you help improve the accessibility to the community, you help improve the health status of the community, and you also contribute to your sustainability. So it's not like this isn't a hard time for us. I mean, financially, this has really been a difficult period because, as most people know, we have a behavior of, if we've got $1, we're going to invest it in what the community needs. We go all in all the time.
Yep.
And but that behavior has attracted a tremendous number of incredible providers and staff to our organization, and that's probably one of the things I'm most proud of is the team, the culture of the organization. If you go out and you look at any of the metrics on the quality and the outcome of this organization, you'd be hard pressed to find somebody as good as we are in terms of outcomes. But people don't really know that. They think it's small little Bristol Health, right?
Yeah.
But it's not. It's truly not. I mean, we have been literally the best in terms of not having people come into our hospital and come in for one thing and have a hospital-acquired condition or infection. I mean, we rival the top of the country.
I've seen that the last few years that you are
Absolutely.
at the very top.
We've
of
never
that.
been penalized for that.
Wow.
That's because the culture of the organization is very team-like. Safety, all those things, leapfrog A. We're waiting right now to see what happens again, but as far back as I can remember, we've been A-rated. We don't, you don't see that on billboards. Maybe we will start to put that on billboards.
Sure.
But it's just what we do. We just went through. I was actually traveling. My daughter got married, so. And then I had to travel a little bit for the American College of Healthcare Executives and the American Hospital Association. And the day that the Joint Commission surveyors came in, that's the only day I was there that week. And they came in with 5 or 6 surveyors. And one of the surveyors says to me, "Oh, we're going to have to schedule leadership meetings at the end of the week and all these kind of things." And I stood up and I said, "I'll just be honest with you, I'm not going to be here all week long. And I trust that this team is going to do an extraordinary job of demonstrating what we do every single day to take care of this community. And so I'm not going to be here, and you'll be scheduling a meeting with this person, that person.
This would not be a week that you would miss.
Well,
at most hospitals,
there's a varying degree to which people, essentially, feel like they have to be there. And then at the end of the week, the surveyors commented that they never once saw, staff like not answering the question, running off in the corner, and possibly texting or emailing her to find out.
What should I say?
And honestly, every morning I checked in with my executive team, and I said, "You have this, you have this," and they pulled off a bunch of the surveyors within 2 days because they could see how it was going.
Wow.
And we actually had a nuclear regulatory survey going on and a survey over at Ingram Manor at the same time. And all of that while I was gone, and it was like they did a phenomenal job. I am so proud of them. Really
and this
proud
is
of
like
them.
the results of a number of years of focusing on people talking to each other,
Yeah.
people having the freedom to call each other on things.
Yeah.
And that makes quite a difference.
It sure does. I mean, I'm a very optimistic person, and in the old days, right? Medical staff members, they socialized, they went to country clubs, they went out to dinner, they did things, and most families now, it's families, 2 workers in the family.
Right.
So that's it's hard to do. You juggle kids, all those other things, and our physician organization is literally governed by physicians, right? And so what I kind of feel is that by having physicians that that come onto your foundation, become an employed member of it, they have to actually participate in committees and on the board because they run the board of that organization, right? And by having them engaged like that, so while they're not out on the golf course or they're not going to the show or doing this thing, because that's just not going to happen today, they're actually meeting their peers, they're talking to them, they're developing relationships. And guess what? You're going to call somebody about the care of a patient more often when you know them than if you don't. And we've become such an electronic world today, so it's really important to have that interface.
I know that there's also been an emphasis on nursing professionalism
Absolutely.
there, and basically opening that up to making sure that they are very, very valued.
Extremely valued. So we're one of the 4 hospitals in the state of Connecticut that are magnet status, a magnet for nurses. The key component of that goes back to what I just said about physicians. So they have a shared governance model. So I use this example all the time. It's, one time we decided that, RNs would have the same kind of uniform, color uniform, because at one time we allowed everybody to just wear whatever they wanted, and their ID badge would kind of say, this is an RN, this is a nurse, a certified nurse assistant or assistant, and the nurses all decided, this shared governance structure, right, the governance council decided that it was better for them to all have a similar color-coded uniform, so people knew who they were, especially in an emergency, you want to know who they are. So I was in a town hall meeting, and one of the nurses said, "Well, you made me go out and buy another. I had to get rid of all my stuff and buy this uniform." And I said, "Well, let me correct you on that because I didn't do that. I mean, you all did that, and so obviously you're not participating in the shared governance model, and I encourage you to do that." So that's a simple example, but the truth is that when the people that are caring for the patients and the people who have the vested interest are actually leading the organization and making the decisions, you get better decisions, right?
That's a great thing. But you still got challenges.
Always have challenges.
And what are you looking for on your
my wish
they
list?
give you a headache every
Yeah. So there's a couple things, and we just started. You had it in the paper. We just started the Suboxone program out in the community, and that's a really important thing for us to do. And the team was so excited about that, that we were able to do that. So you get your first dose, and we connect you to a community provider, so we can be assured you're going to have that continuation, and it's proven to get great outcomes. So the team was actually in a community kind of a meeting, and they came back and they were a little bit distraught because it was like we did this great thing, we've put it together, but it's not enough. This is not enough, right, Mike?
Yep.
I mean, the opportunity, especially when you put people together to create programs, to create change, positive change, and address things like substance abuse,
right?
Really, really important. And so then you have to say to yourself, well, what's it going to take to do more? What's going to take more resources, right? So it's a balancing act. And so that kind of makes me drop back to this hospital tax thing. And this hospital tax, I mean, you think about it, and I don't think people understand. We're taxed at a rate higher than any corporation in the state hospitals. And it was really funny, you know, so you saw that the state of Connecticut was suing the federal government over the salt tax. So the federal tax changes that, you know, somehow unconstitutionally affected certain states worse than others, states that have high taxes. So I was reading that whole case in the newspaper and listening to the arguments that our attorney general was making. I'm like, are you kidding me? Those are exact same arguments that I would make to end the hospital tax, but here's the state arguing against the federal government, but they're doing the same thing to the hospitals. It's like, are you kidding me? And we're nonprofits, right? So so right now they're taking a little over $4 million a year from us. Think about how much that $4 million would do to improve our substance abuse program, right? I mean, it would be, exponential what you could do to help. And there's so many other things. We have community care coordination teams. We have resources that we need. I mean, we just lost our state funding for our parent-child program, you know, a significant portion of it. And so right now we're trying to figure out how to, you know, synergize that with some other programs in the community, sustain those services that this community needs. They're absolutely critical. So. But anyway, so the hospital tax, and then the other thing is, and I know this isn't going to be a popular statement because so many seniors rely on these Medicare Advantage programs, right? Yep. Medicare Advantage programs, it's not a bad thing for seniors. Unfortunately, though, and I brought this, so I'll show you this. I'll show you this. This is a report from Medicare Advantage appeal outcomes and so on and so forth. It's done by the Office of the Inspector General, and it's dated September 2018. And what essentially it says is that very few people appeal their denials, you know. But the ones that do appeal, on the first appeal, 75% are overturned. So, and on the first appeal, and there's a series of appeal process in there, right? And the thing, and it also says a lot of other things, but let me just tell you on the ground floor what's happening. So you see these plans advertised every day. They're all over Connecticut. Now, in some states, they don't have them because the providers haven't accepted them, right? So in order to have them in the state, then all of the hospitals and all the providers have to accept them. That's key, or the insurance companies couldn't offer them. So they're good for seniors because deductibles, co-pays. There's no, you know, surprise. Oh my God, I got to pay this month. They get things like glasses, all these other things. Gym memberships. I mean, I saw that this weekend. And but what you have to understand is that once the government sets that program up, it's just like any other insurance product, right? So the thing that's really frustrating to hospitals is that in order to move a patient from one site to another, these plans have the absolute right to authorization. Now, so how does that play out? So there was a gentleman, an elderly gentleman, maybe 4 or 5 months ago, comes into the hospital. He doesn't have any support structure out in the community, lives alone. He has cancer, chemotherapy. He has multiple other medical conditions, indwelling catheter, all of these things, and he's having some severe problems. And he comes into the ER on a Friday afternoon. So we figure out what to do with this gentleman and where he needs to go. He needs to go for acute rehab services. And that's an advantage to the Medicare Advantage plans, is that essentially you don't need a 3-day qualifying inpatient stay, that dreaded 3-day stay, and you can go directly to a facility for long-term care. But guess what? He was there on Friday afternoon. These services do not have authorization services on weekends.
Oh, gosh.
So they don't. And so this gentleman basically got parked in the hospital for the entire weekend. Now, did that guy get the care he needed? Absolutely not. Did we take care of him? Sure. But did he get the service that he actually needed to get better? No.
So we've got to watch the tax issue.
Tax issue.
We've got to go, but I'll tell you, this is a big issue, and obviously at your heart. And Kurt, I'm so happy for you to be here, and you'll be back. You know that.
I would love to come back. I'll talk to you more about the Medicare.
And we appreciate you guys watching our show, watching the newsmakers in our community, and hope you'll get back to us the next time for Central Connecticut Now.